In this video, I'm going to talk about the significance of using a strategy called zigzag lines. Yes, it sounds a bit funny, but this is a wonderful strategy where you score more marks because you're impressing the patient and examiner with this strategy. And when you practice this properly, you save a lot of time as well. Okay, so see, if you look at this diagram, it looks like a lung to me. I've drawn, lungs, and this is how I exactly draw in my exam when I'm actually explaining something about the lungs. All I do is line diagrams, and this needs a bit of practice. You don't need great practice, but whenever you're explaining the management to the patient, I usually take the pen and paper. Usually in any clinical exam, you're given a pen and paper. So what I do is I take the pen and paper. When I start the management plan, before I start, the first thing I do is draw a diagram. This is how I draw a lung. In this, when I'm explaining about asthma, where it says 1, I will draw the diagram. This is, the airways, right and left airways. And where it says 1, I will say this is where the air goes into the airway. And where it says 2, and where I've drawn 2 arrows there, the green arrows, I will say these airways are a bit narrow. Okay, because of the narrowing of the airways, you are not able to breathe in properly. Okay, that is the reason you have this difficulty breathing. This is how I simply explain about asthma in simple line diagrams. I've seen many doctors, when I was an examiner for mock exams, for some reason they try to draw artistic diagrams and waste their valuable time. It's not worth. Time is gold in a clinical exam. So draw line diagrams. All you need to do is convey the message to the patient. Okay, in this slide where it says 1, I want to explain that this patient has a lower lobe pneumonia. And all I do is draw two diagrams and just put a bit of, I just highlight the area where it's a lower lobe. And I'll just say, look, we did an x-ray. On the x-ray, at this place, you have a bit of fluid accumulation or you have a bit of infection, and that's the reason you're having this cough, you have this fever, and you're not feeling well. See, it's explaining everything in a simple way. This is a great strategy. Unfortunately, no medical book teaches this, and I used to use this a lot when I'm actually explaining the diagnosis to the patient. I hope this strategy will be helpful. So to summarize, this is how I use the zigzag line strategy. I hope this will be helpful. Just do a bit of practice. If you're drawing a heart, try to actually draw a box or a square, divide it into 4 parts, just label, your right atrium, left left ventricle, right ventricle, and just explain to the patient, there's a blood vessel here. Draw line diagram again and say there's a clot here. Because of the clot, there is reduced blood supply to this part of the heart, and that's why you have this chest pain. See, it's very simple, and this is the best way for you to actually explain the management to the patient. I hope this helps. Try to practice this. Please don't go to the exam without practicing this. Anything I teach needs practice. When you're preparing, when you're doing role plays with your friends, draw these line diagrams, explain it. If you're a practicing doctor, teach, use the same thing, draw diagrams, explain it to the patient. In my real consult, when I talk about shoulder bursitis or disc prolapse, I draw line diagrams, and the patients are very, very happy when I actually draw diagrams and explain to them. So make sure you use this, and believe me, this will save a lot of time. You will have very good impression both from the patient and from the examiner.